All right. Hello, everybody. Welcome. Thank you for taking the time just before all the break sets in. I know it has set in for a lot of people, so we appreciate your finding the time to be here today. Just to start you out with a little bit of some housekeeping. So I just hit the record button on this call, so be aware that we are recording and that when we record, that we will then post this to our public-facing website. So be aware that everything we're saying will become public domain. When you are with us, what I've been doing is I see people come on as I'm muting them. When you go down to, when you hover your mouse over the bottom of your screen, a little bar pops up and you can mute yourself there if you're using your computer, or you can mute yourself on the phone. I never remember, is it *6 to mute yourself on the phone? And then *6 to unmute yourself. So you can mute and unmute yourself via the computer. And if you are on the phone, just make sure that your computer is muted, just so that we're not getting any feedback there. Don't put us on hold, please, because we will all hear it. And if at all possible, do not use your speakerphone if you can, because that comes across tinny in this particular platform. And we really, as with everything with this project, your participation is truly essential to making it worthwhile and valuable for everyone. So you can unmute yourself to speak, or we also have the chat box. At any point you can throw something in there. Several of us will be monitoring it as we go, and we'll jump in when we can to make sure that whoever's speaking is alerted to that. So do not be shy with using the chat box. You'll see that we already posted a few things in the chat box that we're going to be talking about. We'll post them again as we get as we're further in the conversation, but once we refer to them, you'll know that they're at the top of the chat box, so you're able to grab if you'd like to. And if you could take a moment now, if you're using your phone audio, to link that with your computer, if you're able to do so. So what you want to do is find your, if you are on the computer as well, you can link them. Gosh. So your name shows up at the top. It says me, and and you should be able to then take your phone number and your participant ID, and then you can put number, participant ID, and number into your phone, and that should link you directly to your to the computer, so that you're linked together as one person. Did that make sense?
And that's what I'm sorry to interrupt. I just I wanted to mention that Mary Webster has reminded everyone via chat to please log in with their name and their state in the chat box, and that will serve as our roll call today.
Great. Thank you for saying that, Mary. I appreciate that. Thank you, everyone, for doing that and taking a moment to do that. And if you do have any other questions and you want to shoot me a little technical assistance question via chat to try to get things going, we're happy to do that. If you have any questions now, you can unmute yourself and fire away. Okay.
Next slide.
Next slide, I think.
There we go.
So I think for this one, Greg, is that going to be you, or?
Yeah, I'm happy to. Shall I kick us off with just the review of the agenda?
That'd be great. Thank you.
All right. So we just did our welcome and housekeeping. And we're going to talk about this call or webinar is focused on sort of our final push, I guess, if you will, around our quality improvement measures for the collaborative, and kind of going through, looking back where we've been and what we've done so far and where we're headed. So we're going to start off with that and then go through a couple of things that we need from you all to sort of make this final push. So we'll go through some of those things and then talk a little bit about data collection strategies as well. And through these, through this middle portion of the webinar, we do want to hear from you all. So we'll have a number of polls and definitely time for questions and things like that. And then we'll wrap up everything with a few final closing thoughts. Any questions about the agenda or comments before we get going? If not, we'll just go on to the next slide. And this is just a nice visual. You can see where all of the states are spread across the continental U.S. there. And for our welcome introductions today, we're just going to use the chat box so we can spend most of our time going through the material and having time for discussion and comments from you all. All right, let's go on and start off with where we've been. How about that? So I just want to say coming up with a measurement strategy for a collaborative like this, particularly a new CoIIN, which is a major initiative, is a huge amount of work. And I have to say that we couldn't have done this or been as far as we have gotten in this time period without all of your participation. You all have been very engaged throughout this process, and it's been extremely helpful. So I thought I would just, as we're closing in on the old year and looking to the new year, it's a good chance to kind of look back and see what we've done so far. So let's go to the next slide, Meg. And this is just a sort of a visual timeline from the beginning in terms of working on some of our measurement work. And it all started back in May when we explored the KETA capabilities with the American Academy of Pediatrics. We also established a measurement work group, which represents all of the stakeholders and major stakeholders in our CoIIN. So that was done in May. And then through the summer months, the measurement work group was very busy. They identified a sort of comprehensive of all potential measures that we wanted to look at, and also selected the modalities that we would use to gather the data. So we ended up with family and staff surveys as our two different modalities this summer. Then at the end of the summer, the measurement work group sort of prioritized and finalized this final set of measures, which we've been tweaking a little bit, but the major sort of list or lineup of measures was finalized back in September. Then as we kind of moved into the fall, we had our evaluation work group review and agree upon the final measures, as well as have our HRSA partners approve the final measures back in October. And that was around the time of our on-site visit, where you all, our on-site work together in Chicago, where you all had some time to work as a team on starting to really operationalize your data collection plans. And I know many of you are still working on those now, but got a good start back in October. And then just recently, we had all the information we needed to go ahead and submit our final KETA application to the Academy. And so they are now actively working on building our CMC CoIIN QI measures site. And when we get to the new year, I guess Meg will when we get into the new year, we'll get to actually see how that's going and see how things are looking. But I'll turn it over to Meg to kind of look at where we're going in this final push to begin our sort of lead up to the baseline data collection.
Thanks, Greg. So I just wanted to take a few minutes to give you all a preview of coming attractions over the next couple of months. I also want to take this opportunity to thank you all for the help that you gave us and the support that you gave us in the work that we've done to this point in pulling together the measure set. I know there were a lot of questions, and we've had a lot of really good and fruitful discussions with one another, and we're pretty happy with where we've come to with regard to the measures. So thank you again for your time and your support on that. With regard to where we're headed, we want to just take a look at this. I'm thinking of it as the snake diagram. I'm sure there is a fancier quality improvement term for it, but we started in the beginning of December, the collaborative partners, after finalizing the common measures, the required QI measures, we sent that and the application to the American Academy of Pediatrics, and they are currently in the process of building the KETA website. That work is going on now, and we hope that it will be completed on or about January 1st. Right now, the state teams are working to identify their team's group administrator for data entry and oversight, And you all are also working on registering your KETA users with AAP to get user IDs and passwords. And then you're sharing all of that information with your state team coaches. A preview of coming attractions there in the beginning of January. You all will be working to determine and submit those supplemental questions that you would like to have added based either on the focus area that you've chosen or that you've decided that you would like to add to the required QI measures. You will be filling out a form if you have additional measures that you would like added and submitting those through your coaches. You will be also submitting a form that will share with us the information around any adaptations that you would like to make to the required QI measure survey, and you'll submit that to your coach as well for feedback. In mid-January up to February 1st, we, the collaborative partners, meaning the AAP, Boston University, and Health Improvement Partners, will be working on adding the state team specific measures to the KETA website. You all will begin completing the KETA testing. Your coach will let you know when it's time for that to start. All state teams might not be able or needed to participate in the testing, but your coach will be the conduit for information around that. And then we'll also complete KETA QI training with you all. And you'll have more information about that coming to you. February 1st through April 1st, we are looking to start the first cycle of data collection into KETA. And April 1st through the 15th, we will be debriefing and adjusting the KETA process based on your feedback if needed. So that's sort of a little preview of coming attractions with regard to what's happening with the measure set. And we're very excited to have passed a couple of really important milestones. And we're looking forward to this now more intensive work beginning in terms of work with the individual cohorts. So I'm going to change the slide to the next and turn the floor back over to Greg.
Thanks, Meg. Before we do, any questions about where we've been and where we're headed? I think we'll be answering a lot of the questions, hopefully, on the where we're headed in the next few minutes. We're going to go into some more detail about some of these final tasks that involve your input and help. But any questions before we do? And feel free to use the chat box if you're unable to speak or unmute. And Bethlyn will let us know if there's things in the chat box. Well, while we're waiting, if there are any questions, I'll just go ahead and move ahead then. To our next.
Wait a second, Greg, let me just say, Meg said that just for everyone to be aware, I'm sorry to interrupt for this because it's just, there's an event coming up, so it's a good time while we're kind of paused for a second. Mary Ciccarelli wanted everyone to know about the 14th National Value-Based Payment and Pay for Performance Summit. Oof, a mouthful, but you can see it right here. So if everyone can see that in the chat box. I've also been notified that a few people are having trouble. They can only chat with me. I had that trouble at the beginning too, and then everyone started to show up. So just in case anyone's having technical trouble in that way, if you click on the two, there's a down arrow next to the name, and maybe it has my name and a down arrow. Hopefully then you can then go back up to chat, send chat to, and at the very top is everyone. So it should have a list of everyone's name. You could send to individual people. And then also at the top, when you click on that down arrow in the two bar of the chat box, then there's also an everyone that you can then choose if you're trying to chat to us all. Otherwise, just chat to me and I'm happy to let everyone else know. Sorry for the interruption. Go right ahead and continue.
Yeah, thanks. All right, let's minimize this. All right, well, let's go to the next slide. And so first we wanted to talk about one of the things that we're going to need to work with you all on is this adaptation process. So as you know, we'll be making standard versions of both this family and staff surveys, but we also realize that many states are going to want to make some adaptations to those standard surveys. So this is the process we wanted to outline how to do this. We tried to make it as simple as possible. So one thing I think is going to be very helpful is Sherry Leonard has created a step-by-step guide just to walk you through the adaptation process. And we're just going to use Word versions of these standard surveys. And if there are adaptations you need to make, you'll just go in and turn on track changes. If you're not familiar with that, it's in the guide. Turn on track changes and save those changes and track changes and use the comment box to explain why the change is needed. Then you'll just upload that to Box and let your coach know that you've submitted your adaptations, and also just copy me as well so I can look at them if needed. And our goal is to get back to you within 4 business days of your submission. So if we have any follow-up questions, we'll do that. If it's all smooth sailing and everything looks good, we don't have any questions, we'll let you know that that's the approved version, which you can save in your folder. And again, these instructions are in the guide. And then Bethlehem, I believe we have the guide for download in the chat box at the very beginning, so you all can look at that after the call or during the call if you wish. All right, let's go to the next slide. And just a couple of details. So if you have Spanish-speaking families are a significant part of your population, and you're going to be using those, BU will be providing standard Spanish versions of both surveys as well. Actually, it'll be just the family survey in this case. We'll provide a translated version of the family surveys to everyone. However, if you're going to be adding questions, which we'll talk about in a minute, or making these adaptations, which we're talking about now, you'll need somebody in your state that you're working with to make those minor translation changes. We wish we had the capacity to help all of you with each individual state's adaptations, but we just will not have that capacity. So we'll ask you to have someone that you work with in your state to make those minor translations, which hopefully won't be a big deal. Another thing I've included in this survey are just some guiding things that hopefully will help you. Oh, go back. Oh, there we go. Yeah, so number 4, I just wanted to give you some tips here that will speed up the approval process and make everything go very smoothly and quickly. So if you stick to these things, minor rewording of the opening and question set preambles. So there's an opening preamble as well as some preambles before question sets. Making minor rewording to those is going to sell through quickly. Also, adding to or making minor rewording of response options will also be selling through quickly in terms of getting approved. And then also just minor rewording of, sorry, the chat box is covering up everything. Minor rewording of questions that don't change their intent or meaning. So if you kind of stick to those things, you're going to sell through quickly. So wanted to point those out. That's not to say that you can't make other changes, but those other changes, we may have some more questions for you or more follow-up that will be needed. We do want to make sure that we're meeting every state's needs with these changes. Another thing that's not addressed here that we were kind of chatting about last night that I would add to this is for some states in certain situations, an not applicable option could be an added response option that would make sense. So that's another thing I would say that's going to probably sell through very easily is if you need to put a not applicable because of the types of patients or the context that just doesn't make sense for you. So I just wanted to specifically mention that as well. Okay, now we can go to the next slide. Anyway, before we get to the poll, any questions about the adaptation process? Again, there's a step-by-step guide that you can download and kind of that walks you through the whole process, but we wanted to make it as simple and easy as possible. So you'll just basically be making some edits to the Word document, sending that to your coach, and we'll get back to you very quickly. Bethlehem, anything in the chat box, or shall we move on to the polling?
Sorry, I started the poll.
All right, good. Let's get to the poll. So we would like to hear, and we thought you all might like to see, how many states are planning to adapt the survey, either the staff survey or the family survey. That's question number 1. And if you are planning to adapt it, what types of adaptations are you anticipating? So we'll leave this poll open for what, about a minute? Give you time to answer both questions.
That sounds good. And if anyone has an other, you're welcome to type that in the chat box so we just get a sense of what else you're thinking. It's just good for everyone to see. All right, I think we're at the end here, so.
Yeah, does anybody need more time? I guess chat Bethlyn real quick, otherwise we'll close the poll. Looks like still some people are voting.
Yeah, we'll give it another minute.
Let's leave it open for just a few more seconds. Let Bethlyn know if you need more time though, and we'll keep it open.
Yeah, just let me know. And Angie did let me know that she's selected, we're not sure yet. It won't let her submit for number 2 for some reason. So there was another little technical difficulty, but.
All right, I don't think we have any new votes coming in, so I think you can close it now, Bethlyn.
Okay, I'm gonna share the results with everyone. Does that sound like I should do that? All right, here we go. So everyone can take a look.
All right, we know that there may be a few states that have a couple people that voted, and that's fine. And there may be a state or two that's not on the call. But anyway, this is probably a pretty good snapshot of what people's plans are. And looks about 2/3 are planning on making some adaptations. A few states looks like are not thinking they're going to need to make any adaptations. And then a few are still thinking about it. So that's kind of about what I expected. And then you can vote multiple times here because you could be making different kinds of adaptations. And it looks like the most common type of change will be with the preambles that set up the survey or set up a certain question set. But a good number of people also are looking at the wording of the questions and the response options. So about half are looking at those as potential adaptations. And then there's a good chunk of other as well. I don't know if you have any of those in the chat box, Bethlyn.
I have none, not so far for other. People are welcome to list what they want to. I did have someone note that their IRB has specific language for the preamble and that why they're going to need to adapt it. All right.
Good.
And also IRB in Oregon.
Yeah, it looks like Oregon as well. Great. Well, thanks for sharing. It's kind of interesting to see.
All right,
a lot of you will be taking advantage of this adaptation process.
All right.
All right, let's go on to the next slide. And then this one, I hope, is very easy, and some of you have already completed this task, but another important thing that we'll need from you all is getting everyone's roles set for KETA. So each state will need to figure out who's going to be their data collection manager, who's going to be a group administrator or data entry staff, one or two people doing that, and then who the participants will be, who can basically access the reports and maybe pull a small number of reports. That's a fair number of folks on the team there. So what we need you to do there, first of all, is to make sure everyone has their AAP number. And there are instructions on Box as to how to do that. It's a very quick process, I found, from hearing from folks. And get all the names for these roles, the email addresses, and the AAP numbers to your coach. I know many of you have done this already, but we do need all these ready to go for Kristen at the Academy for setting up our site by January 2nd. So hopefully you'll get this done before the holidays, but we realize there may be some stragglers that you need to track down or get the AP numbers for after the holidays. So as soon as you come back, though, please do that. So we're aiming for January 2nd to have all these sort of names and addresses and AP numbers in. to the Academy.
Greg, there's a question, and I just wanted to let everyone know I put the direct link to Box for the AAP number document.
Mm-hmm.
There's also a question. I'm hearing some feedback. Let me just pick the question first, and then I'll try to deal with the feedback. Does the data collection manager have the same rights and access as the data entry people?
I'm not sure of that. I'll have to look into that, but I believe so. But we can verify that. Any other questions on the chat box?
The rationale behind that question was that they could cover them so that allows there to be coverage.
Mm-hmm.
So that was I think the idea behind it is trying to make sure that they've got coverage when they need it. Mary thinks that each team will need to make that decision about how level of access for their individual people that are touching the data.
I will, after the webinar, I'll double check on this, and we can send it with the follow-up information after the webinar, the answer to this question. Any other questions? All right. Let's go to the next slide. So I'm going to turn it over to Mary and Carrie now with a couple of other things that we'll need your participation in, and also just to talk about some good principles to help you get off to a good start as you're collecting your baseline data.
Thanks, Greg. Hi, everyone. This is Carrie. So we did ask you guys to take a doodle survey a little while back. Let me start sharing my video here. There we go. To find out how you currently plan to collect your family surveys. So Meg, if you'll go to the next slide for me. You all will see here the results from that survey. So you can see that 4 of the state teams plan to have families fill out the survey independently using an electronic system like SurveyMonkey or RedCap. 1 team plans to collect the information by having families respond in person to an interviewer, while the interviewer uses paper and pen to record their responses. And then 1 team plans to conduct in-person interviews while recording those responses electronically. And then you'll see the remainder of the 3 teams chose other, and they're either planning to use a mixed modality method, or they're unsure of the data collection plans at this point in time. So we wanted to just go ahead and show you this because we do think there will be some opportunities for cross-sharing and potentially group coaching as teams begin to test out their data collection strategies depending on what type of strategy you choose to use. We wanted to take a second.
Carrie, I'm sorry.
Go ahead, Meg.
I just wanted to jump in and say one thing about this survey. There were states that replied to more than 1 option, so you'll see that the numbers here add up to more than 10.
Perfect. Thank you, Meg.
Thank you.
So we did want to take a second now to get a little more information from you. This information is going to help us at the collaborative level with our planning, and it'll also help us provide some more targeted coaching, and hopefully it will be helpful for you all to hear what other states are planning as well. So Bethlyn, if you could pull up the first question for me, that would be great.
So it will end up pulling them all up, like it's going to be kind of all 3 questions at once.
That's fine. We'll roll with it. I'm sure it'll be great.
All right, here we go.
All right, so the first question here you will see is, what electronic system are you planning to use? So are you planning to use RedCap, SurveyMonkey, a data registry, or something else? And if you do choose something else, if you could please type that into the chat box so we can know what that other is. And I'll go ahead and go through all of these so we can take a second to answer all of them at the same time. So the second question is around if your team family members will be administering the survey. And then the third question is around if you foresee any barriers to data collection. And if you do, we'd love for you to type those in the chat box for us. Give everyone a second here to vote. Not seeing very many changes in the voting right now, but we'll give maybe another 10 seconds. Seeing some good barriers go in the chat box.
Also, a few people mentioned, Carrie, that they're using Qualtrics, Oregon, Kentucky.
Wonderful. Okay, so we're seeing some barriers would be time to complete. Of course, we've got survey fatigue, which I'm sure we're all familiar with, and low response rate. All right, so we'll go ahead and take a look at the results here. You can see that 42% of you guys are considering using RedCap, while 17% SurveyMonkey. And then we've got about a quarter that chose other and another 17% that said they're not quite sure yet. Like Bethlyn mentioned, that there are a couple of people that plan to use Qualtrics, and I see Paula mentioned that they're using their population health application. So we asked this question again because we want to see where we can group teams as they test these applications out so we can have some joint learning, but also because we may be able to help create some survey templates if there are a couple of platforms that are going to be more widely used. Right. And then the second question here was whether or not team family members would be administering the survey. It looks like 3/4 said no, while a quarter said they're not quite sure yet. And we're curious about this because, you know, it helps us get an idea of how you plan to engage those family member representatives. And then the third question was around barriers. So roughly half and half. Half of the people expect there to be barriers, and the other half feel like it's going to be pretty smooth sailing, which we hope it will be. I mean, we talked about some of the barriers that were input into the chat box here. So again, the survey fatigue, time to complete, low response rate, and then also the process being complex. So
One last, Carrie, I'm sorry to interrupt. One last one I see, another barrier is lack of access to computer or the internet.
Yes, thank you.
You're welcome.
So any other comments before I turn it over to Mary? She's going to give you guys an opportunity to share some tips for success, and then hopefully those tips will help you begin to plan to overcome some of these barriers that you're mentioning.
Well, good afternoon, everybody. Excuse me. Hope everybody's doing well this afternoon. So we're interested in what you have to say about data collection and the pearls of wisdom. We often mention that. So if you wouldn't mind adding again to this chat box, we're overutilizing our chat box today, but in a great way. Please add one thing, think about one thing that maybe you learned in the past. I think a lot of you have done other quality improvement initiatives. So one thing in the past you've learned about data collection strategies that you might think your fellow teammates on the call might like to hear about. It doesn't all have to be positive, okay? So just one, words of wisdom that you would have from past data collection strategies. So I'll give you a moment to do that in the chat box. Not to procrastinate, oh boy, do the frog.
Did you see above that, Mary? Everything takes longer than you think it will.
Oh yeah, that's true. And we found that out even in our own own work within this coin. Things do take longer than you anticipate. Incorporating it into other processes. Thanks, Ariana. That's so true. You know, we've often talked about when collecting, doing measures and collecting data, you want to be careful of data burden, and you will get more buy-in too if it is something that you can have as a way to include it in the work or work it into what they're already doing or already collecting. You'll make more friends that way. Dedicated iPads. Wow, that's great. Same experience with that. So people have used that before. In person, getting higher yield of return that way. Oh, I love this, Tamara. One time they held an informal coffee with parent organization leaders to explain the surveys and get the rationale behind them, and the family leaders appreciated being informed. And that brings up a good point about we have to sell this. And I know I've talked to a few of the teams about this. Like, how are we going to sell this survey? Because I know you're concerned about the fatigue, and rightly so. So we're going to have to get our families on board with this and why this is important that we get this information. You know, we're not just bothering them to bother them. You know, we have a really good reason to get this data. And so we need to be thinking about how, you know, our verbiage and you know, one good change idea is coaching your customers to use the product. So we got to coach these families that to fill out these surveys. You know, this is a wonderful coin to be involved with. We're going to get such novel information, stuff, you know, about our measures and what works, what doesn't work, and we want to do it with them. So do be thinking of that. Great ideas coming out for Meg, and she's right. Pilot testing with family partners before surveying to everybody. Oh, definitely, Lolita. We definitely want to do that. That's a great PDSA. So if you think of others in the meantime, certainly go ahead and chat away.
Mary, do you mind if I just throw in there a few further up you may have missed? One was different families have different preferences on how they prefer to participate, using the computer, talking to someone, etc., which I'm sure can make it more difficult. So just being aware of that to potentially offer different options, and have to be thoughtful about how to handle issues and concerns that come up during the survey. Oh, wow, yeah. Yeah, so you can tell we're going to be doing a lot of PDSAs ourselves to get us ready to do this work. And that's, you know, those are going to be some more of our topics going forward for sure. Greg said preparing respondents ahead of time. Did you just say that?
No.
Oh, getting them to understand the importance of the data and following up how the data is going to be used to improve care. Yeah, exactly. You know, that's part of that coaching them. I know I'd be more likely to fill out a survey if I really knew how it impacted me. Okay, well, thank you, everybody. So
we will share all of these. Mary Ciccarelli, very adeptly.
Oh, okay, yeah, collect and oh, yes, definitely. Yeah, we're
the chat, so we're going to be able to. It's recorded as well and sent to us, so we'll be able to pull out these great suggestions to share with everyone.
Yeah, there was a method to our madness, Mary, of getting y'all to put them in the chat box, so we would have a copy of them. Excuse me. So yeah, that's a big part of our CoIIN is sharing with each other, correct? Okay, thank you for that. So the lovely data management plans, you know, we introduced those to you we saw them at the on-site, and you know, we talked about them, and you know, and oftentimes it's like, why do we have to use these, and you know, what are we going to do with them? So let's talk a minute about that. So you can go to the next slide. So here is a picture of one of the ones we're using. And you might recognize this from a slide that Greg used at the on-site in Chicago. And as you see at the top, it lists the measure. So this one was around medical home and shared plan of care, et cetera. What type of measure is it? So you remember we talked about the process measures and outcome measures and then the balancing measures. So you label that. How will it be collected? That's the process. When will it be collected? So the time period. Frequency, we've already added that in there. And then the respondent, families, and we added this part too for you, a random sample or a consecutive 40 parents. Notes or special considerations. So one good thing though, the table, there are a lot of processes of like how and when you're going to collect it and stuff. That's going to be the same for all the questions. So probably not going to be much difference there. So you could merge merge the cells. It's hard to say. Make that a little bit easier on you. And because I know you think, oh my gosh, this is long. So try to save yourself some time there. This is essentially what this looks at. Now, why is this important? Let's go to the next slide. So it is best practice and getting teams to think through the details. And this is the most important bullet of all of these. Oftentimes we look at it face value and say, okay, we're going to collect 40 samples and we're going to do it on Thursdays on, one day a month, this, that, and the other. But there's a lot to think through. And this forces you to really think, well, who is going to do it? And when are we going to do it? And where are we going to do it? The who, what, when, where, and how that we talk about a lot in QI. And then also the notes and consideration. That's very important. You may have some folks that you're just not going to be able to give the survey to. There's just the very few clients that you have, the families that you have that have a language that you're just not going to be able to get it translated to, or sibling pairs or something, whatever you've decided as a team. So you'd want those on the notes or consideration. It helps you to rethink at a higher level. You're not going to be just writing it down. You're really thinking through those strategies. You'll be so thankful you did this down the road. Writing it down, getting it in concrete, write it down in pencil at first if you need to, talk through it, see what's rational. You can even simulate obtaining the data, when and how and who, if that would be helpful. And then, you got to find out what's best for you and, what's best for your group and your team. If you have multiple data collectors, and I think that kind of goes back to that one question that was in that Greg's going to ask AP about, but if you have multiple data collectors, you want everybody to do it the same way, right? So that's why it's very important that the directions and the step-by-step that this form provides you with will make sure that happens. And so many of you may have a couple people assigned to that just to help with, their own fatigue or their own scheduling and things like that. You want to have it written out. And then, of course, for sustainability and handing it off, maybe you end up getting put on another project. No. But if you do, or you're going on vacation, going on a nice leisurely vacation, but somebody has to collect the data. You want to have it written out very clearly, the who, what, when, where, and hows. Any questions about the why bother? Or do you have any other strategies here that, other than what we've talked about? These are what we thought were some of the most important high-level things to think about, but just remember, getting time to think through this is very important.
Mary, this is Greg. I just have a suggestion, probably applies to everybody. In the notes and special considerations, you might want to think ahead. I know many of you are. If we have a single data collector, what if they're out? So who's going to cover for them? Or if you have multiple data collectors, if one or more of them is out, you may need to pull in somebody to help. So kind of already thinking through contingency wise, who's going to plug in or help out if one or more people is absent during the data collection period, and kind of already having those people prepared to do it before having to do it the last second. Mm-hmm.
And we speak from past experiences when these things have happened. And it's like, well, I'm sorry, we don't have any data to put in. Why not? Well, the data collectors have been on vacation. And it's like, bro, we forgot to plan. So this is a great planning tool. But yes, having those people teed up and ready to do it, though, it's not a surprise for them. They know what's going to happen. Thank you. Anybody else have a comment? I think we're doing great on time, so I'm excited about that. So part of your steps and next steps for you will be getting these measurement plans filled out to your best ability and sending them to your coach. You know, and they're going to go in Dropbox, and Bethlyn is always so great to let us know, let us all know where those will go. But you can start with your coach, and then we want to go over those together. You know, I don't want to, the next time I get it, and the next time we all talk or Carrie talks to her teams, we're going to want to go over that and see, you know, if we see anything or if we have questions. Or if you have questions. Questions about the last, you know, Carrie is in my section, either with the survey results or data collection. You know, and going back to some of the previous comments, everyone, I see that survey fatigue is a big concern for those of us. So I'm going to pose that out to our team, our leadership team here, the project team, to think about ways that we can share strategies with you about that, because that's a reality, and I could see how you would have that concern. And that's where our family partners will be helpful too, I would think, to give us advice about that as well. Now, you may have to come off mute if you want to do a, you know, you will have to come off mute if you want to give a comment out loud. I see Kimberly's name popped up.
If you want to come off mute, this is Bethlyn, you just hover over the bottom of your screen, a bar pops up, and there's a mute button there that can unmute if you're on the computer, or *6 should unmute you on the phone. Or you can type in the chat box if you're on the computer. Thanks.
All right, well.
Mary, this is Greg again. One thing, I was just looking on Box, I thought we had shared this as an example of another measurement plan from another project. You know, with it filled out with some of the details. So if that might help some folks kind of think through some of the details that they would want to be considering, we'll add that to the box.
Oh, yeah, definitely.
Implementation of measures.
I know I like to look at other examples. That helps jog my memory, my thoughts process a little bit. So yes, we certainly can do that.
We also just got another comment. Tamara Bakewell said, families who may be having a less than positive experience often feel like it won't matter anyway to fill out a survey.
Oh wow, that's a thought, and that I think that that'll have to go into some of our verbiage or our coaching of our families. Ask your family partners what they think and how to address this, because that does seem no, that's not going to happen with us. You're right. Because we're going to, you know, our families are going to know we really care about their experiences, the good, bad, and the ugly. Okay, well, feel free to continue typing away and knowing that we're going to share all these great ideas with each other and answer your questions, and then we'll get that measurement plan example put in the measurement file, and we'll just go on forward.
So Mary, were you going to?
I can, sure, I can finish this up.
In your coach role, I feel like you have the voice of authority. Thank you.
Yeah, I say, no, wait a minute now. No. Yes, for Carrie and myself, we would love to see your KETA registration information and those AAP numbers by January 2nd, if at all possible. Your team's measurement plan by January 15th. Your team's state-specific measures by January 15th. So that's going to be a big date on your calendar. And any proposed adaptations to your surveys by January 15th. So January 16th, we'll all have a party because we will celebrate all the stuff you did by January 15th. So, and thank you, folks, we appreciate your hard work in getting this done by these dates.
Mary, could I just mention that we did create a table, so I just dropped it in again. It's at the beginning of the chat box, but I dropped it in again, and I'll put the box link in a second. I just wanted to just want to say this, and then I'll go back to that activity. But this is a file that you can use to share on Box. We have a spot, and I'll put that in some of the follow-up materials. I'll drop it in here too, where you can post so that you could see what other people are proposing for their state-specific supplemental questions, and it also helps you to organize yours. So this is a table that IP created for being able to help organize that work, and also to share it out with other states if you're interested in seeing. So I'm going to give you the link to the exact file, and then I'll show you the pathway to that too in just a minute.
Oh, that's awesome.
All right, thanks.
Yeah, the more planning tools we use, that that helps you with your project management. So that's.
And if I could just jump in for 1 second, I want to double check this information with Bethlyn to make sure it's accurate. I think we're planning to upload the recording of today's webinar along with the chat transcript and the slides to Box following today's webinar. It usually takes an hour or two for Zoom to send us a copy of the recording, but once we get that, we're going to upload it to Box, and we're also going to put it in the December issue of the e-newsletter, which we anticipate going out this afternoon. Is that correct, Bethlyn? Is all that right?
Yes, I'll be able to post a Box, and it is my sincerest hope that I will be done with that newsletter by the end of today.
Sounds great. I know we've thrown a lot of deadlines and dates at you all today, so we want to make sure that we have those all available to you in writing for your reference as time moves on. I think we've mentioned this before, but we may not have had the opportunity to mention it to everyone. Boston University is closed between the 24th and the 1st of January. But if you have any time-sensitive questions or problems, while I won't be on email, you can always try calling or texting me on my cell phone, and my cell phone number is in my email address in my signature. So don't feel like we're just disappearing on you next week, although it might feel like we're disappearing on you next week if we're not on email. We're still available.
Okay. So let's.
Were you all set here, Mary?
Yes, I am.
Okay. Let's go ahead and move to the next slide. So our next webinar is scheduled for January the 22nd from 2 to 4 o'clock in the afternoon. We may not need that entire 2-hour time slot, but it looked from what the content we were thinking about at this point that we might need it. So we want to have that on your calendar. If we cut it down to an hour, then we're giving you a gift of an hour back. But in the meantime, we didn't want to take a chance on folks feeling that they were missing out on something if they had to leave a call earlier. You will also note that we're having a December webinar, and the next one is scheduled for January because we had postponed the November webinar. So we got slightly off our bi-monthly schedule, but starting in January, we'll get back on that. I also wanted to make just a couple more before we get to the evaluation, a couple more newsy-like announcements. The first is you should have gotten an Outlook calendar invite today about the next open office hours. We noticed on our calendar that it was scheduled for January the 1st, and no one's going to be around that day. So we've rescheduled it to Tuesday afternoon, January the 8th from 4 to 5 p.m. Eastern Time. So that's the opportunity for you all to just sort of drop by during open office hours, ask any questions that might be on your mind, questions that you might that might have come up since our last opportunity to interact with one another. I would imagine that a lot of folks will want at that point to talk about some IRB related questions that they have. So we'll certainly be available to you on the 8th to have that conversation if that's what you're interested in, or any other topic that you might be interested in. Meanwhile, with regard to the IRB, I wanted to mention another piece of news. You all will have noticed, if you took a look at our Boston University IRB expedited approval letter, that Boston University's IRB is requiring consents from the folks who are filling out the surveys. And so we spent some time thinking about that, feeling that you all signed up for our quality improvement project, probably feel that this is an unanticipated additional piece of labor that Boston University is requiring of you. And so we have gotten permission from our IRB to do the consent process for you if you would like us to. If your local IRB says there's no need to consent because this is a quality improvement project, the Boston University IRB is still requiring consents, but we will take on that labor for you if you would like us to. I'll have more details on how that process will work on open office hours on the 8th and in the next issue of the e-newsletter. But in the meantime, I just wanted to reassure anybody who is anxious about that burden of labor falling on them with regard to a quality improvement project. We are hiring a new research assistant, so we'll have the hands on deck here to be able to help you with that. The reason that our Boston University IRB is requiring consent is twofold. One, because we're going to be looking at the results of your data on the network level, not on the individual state level, but on the network level. And we want to write about it and publish about it. And secondly, because children with medical complexity are a particularly vulnerable population, they have special protections, human subject protections. And so that's the rationale for the requirement behind our IRB. I'm going to go ahead and turn it back over now to Bethlyn, who will talk to you about evaluation, and hope that this was helpful to everyone. Bethlyn?
Hello, everybody. So before we do that, so just so you know, if you now scroll up just 2 or 3, the evaluation link is right there if you want to just grab that so that you've got it. I will be sending an Outlook invite today for the webinar for everybody. We just had set that date, and so now we can share it with all of you. And then there were a few more questions, Meg, about consenting. So here we have, if we still do consent but do a waiver documentation, would this still be okay under the BU IRB protocol? And so, Allison Sublett asked that, and Allison Martin had the same question.
If I'm understanding the question, clearly our IRB would like documentation of consent for everyone. The local IRB can waive consent, but because we want to publish the network evaluation results, our IRB is requiring consent.
So the bottom line is because BU IRB is requiring consent, we'll need to ask all the states to get consent.
We'll either we'll have to have consents from everyone who is involved with the survey data collection. The states can do that consent themselves if they prefer, or if their IRB prefers them to do it. If their IRB says no, it's fine with us. If Boston University staff does it, we're happy to take that on for you all.
Mm-hmm. So they can, but you they can waive documentation if they do it locally.
Their IRB can waive their own documentation, yes, but we will still need to have it for Boston University's purposes.
Okay. All right. Are there any other questions before we just make sure everyone's got the evaluation?
Bethlyn, I do see one question from Angie. She wants to know if we're sending out calendar appointments. She doesn't think that she saw the one for the revised open office hours.
That I did send that out, so if you didn't get it, let me know. I'm sending out the one for the webinar today. So, okay, Angie did get that one. She meant the webinar. Okay,
okay. Okay, great. Yeah, the webinar one apparently hasn't gone out yet, so stay tuned for that. Preview of coming attractions.
And Bethlen, just one more thing I realized I didn't mention earlier is it's been a while back to actually our on-site meeting since we updated the FAQ document. So in case that's helpful to you all as you're working through all the measurement plans and details in the coming month, I'll be going back and updating it and revising it based on what we know now. I know there's some things in there that need to be tweaked a little bit or adjusted. So we'll be doing that. And certainly if you have more questions, send them my way or send them Bethlen's way and we'll get back to you. I will follow up, like I said, about the question for the data manager's rights being the same as data entry. I'm pretty sure that's true, but I will just verify that and let you all know in our follow-up. I've also sent Bethlen an example of a measurement table, which will load up on Box as well, in case that's helpful to some teams.
So I see we're right at the top of the hour. Bethlen, are we all set with wrapping up and wishing everyone a happy holiday season?
Yeah, I don't think that there's anything else. The evaluation link, I dropped it into the chat box, so people don't need to try to write it down. So if you, yeah, okay, great. So if you just scroll up a little bit, you should find it, maybe now 8 messages. And then Alice, just want to make sure we know that they just sent out, there is a way to get a consent signature in Qualtrics. So for anyone that is using that platform, that's kind of a neat feature that you can actually get a consent signature in. So yeah, I'm going to just, if in the follow, I'm going to send a follow-up email and I'll make sure to summarize all this information there. And then we'll also sending out the e-newsletter and we'll make sure that we have links to things. And we just hope everyone has a fantastic break of whatever that looks like for you. And hope that you get to have some sort of a little break here. And happy holidays and happy everything.
Happy holidays all. Thank you very much for spending time with us this afternoon. Thank you, Mary and Carrie and Greg and Bethlen, for your contributions. We'll look forward to being in touch again after the new year.
Yep. Happy holidays, everyone.
Bye-bye, everybody. Thank
Bye-bye.
you.
Bye.